Hello everyone, welcome to the series on dental anatomy. In today's video, we will discuss about permanent mandibular central incisor, its chronology, dimensions and morphology. Let's start with some key points. The permanent mandibular central incisor are two in number and are the smallest tooth among the permanent dentition. They are positioned centrally in the mandible on either side of the midline with the mesial surface of each tooth in contact with the other. Their primary function is to cut or slice the food into smaller particles so that it can be easily chewed. They also play a vital role in our speech through proper articulation of words and are essential for maintaining a good facial aesthetics. So, if we look at the nomenclature, that is permanent mandibular central incisor, it provides complete information about the type of dentition, positioning of the tooth and its function. That is permanent, meaning it is a part of permanent dentition. Mandibular, meaning it is present in the mandible or lower arch. Central, meaning it is present centrally along the midline, and the term incisor is derived from the Latin word insidiare, which means to cut. Now coming to the chronology, permanent mandibular central incisor erupts at the age of 6 to 7 years and is one of the first permanent tooth to erupt in the oral cavity along with permanent first molars. The first evidence of calcification is seen at 3 to 4 months. The crown formation is completed by 4 to 5 years and the root is completed by 9 years. Next, we will look into the dimensions of the tooth. The overall length of permanent mandibular central incisor is around 22 mm, of which the crown length is 9.5 mm and the root measures 12.5 mm. The mesiodistal diameter of the crown is 5 mm at the crest of curvature and 3.5 mm at the cervix. The labiolingual diameter is 6 mm at the crest of curvature and 5.3 mm at the cervix. Lastly, the curvature of the cervical line. It is 3 mm on the mesial side and 2 mm on the distal side. Now, let's understand the surfaces, line angles and point angles. The permanent mandibular central incisor have 4 surfaces, that is labial, lingual, mesial and distal surface, and one incisal ridge. The important point to note here is that the term incisal ridge refers to rounded incisal portion that is found in newly erupted incisor tooth. As the tooth undergoes occlusal wear due to mastication, the incisal ridge becomes flattened and is then referred as incisal surface or incisal edge. So, in some textbooks, the incisors are said to have 5 surfaces, and both concepts of 4 surfaces and 1 ridge or 5 surfaces are correct. Next, the permanent mandibular central incisor have 6 line angles. These include mesiolabial, distolabial, mesiolingual, distolingual, labioincisal and linguoincisal. That is, we have mesiolabial, distolabial, mesiolingual, distolingual, labioincisal and linguoincisal. Next, the tooth presents 4 point angles. These include mesiolabioincisal, mesiolinguoincisal, linguo-incisal, disto-labio-incisal, and disto-linguo-incisal. Now let's study the tooth morphology in more detail from different aspects. Starting with the labial aspect. The crown is trapezoidal in shape with the shorter of the uneven side at the cervix. The labial surface is smooth and symmetric. It is flat in the incisal third and becomes convex in the cervical third. In newly erupted teeth, mamelons can be seen at the incisal ridge with fine developmental lines. The incisal outline formed by the incisal ridge is straight and is at right angle to the long axis of the crown. The mesio-incisal angle is sharp and less rounded when compared to the disto-incisal angle. The mesial outline moves straight from the mesio-incisal angle to the contact area and then tapers evenly from the contact area towards the narrow cervix. Similarly, the distal outline also moves straight from the disto-incisal angle to the contact area and then tapers towards the cervix. The crest of curvature on the mesial side and the distal side are incisal to the junction of middle and incisal third and places the contact areas at the same level. The cervical outline formed by the cervical line is convex in shape with the convexity towards the apex. Now coming to the lingual aspect. The lingual surface is smooth but narrower as compared to the labial surface since the crown converges in a lingual direction. The outlines of the crown are similar to that seen from the labial aspect. The incisal outline is straight. The mesial and distal outlines are straight in the incisal third and tapers towards the cervix, and the cervical outline is convex towards the apex. The lingual surface presents important features that includes lingual fossa, cingulum, mesial marginal ridge, and distal marginal ridge. The cingulum develops from the lingual developmental lobe and presents as a convexity in the cervical third. The lingual fossa presents as a concavity in the incisal part of the tooth, and the mesial marginal ridge and distal marginal ridge forms the mesial and distal outlines of the lingual fossa. Now moving on to the mesial aspect. The mesial surface is convex and smooth in the incisal third and becomes broader and flatter in the middle third and quite flat in the cervical area. It may present a concavity in the cervical third just above the cervical line. The labial outline of the crown is convex at the cervical portion and then tapers straight from the cervical curvature to the incisal ridge. Lingual outline is convex at the cingulum, followed by a straight line that inclines labially. It then becomes concave in the middle third and move incisally to join the incisal ridge. The incisal outline is formed by the incisal ridge. It is rounded and appears like a small arc. The cervical outline, representing the cemento-enamel junction, presents a marked curvature in the incisal direction. The distal aspect is similar to the mesial aspect. That is, the features on the distal surface are same as that on the mesial surface. The key differentiating feature is the curvature of cervical line on the distal side. It is 1 mm less than that on the mesial side. Also, the developmental depression on the distal surface of the root may be more pronounced, with a deeper, better defined developmental groove at its center. Now coming to the incisal aspect. From the incisal aspect, the crown appears bilaterally symmetrical, that is, the mesial half of the crown is almost identical with the distal half of the crown. When we keep our line of vision along the long axis of the tooth, more of the labial surface can be seen as compared to the lingual surface. The labial surface appears broad and convex, while the lingual surface presents concavity at the incisal third with the mesial and distal outlines converging towards the cingulum. So, that was all about permanent mandibular central incisor, the smallest and the first permanent teeth to erupt in the oral cavity. In the next video, we will talk about permanent maxillary incisor. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such content.